Guys, this is Luis Moreno with Think Medicare, Think ACA. Today I have our guest Lucy from Advanced Diabetic Supply, and I have her on today's recording because here's what she does, guys. We as agents, Medicare agents, even ACA agents, we've got a problem, or our insureds have a problem that, or not, maybe not even a problem, but something, an issue where the Advanced Diabetic Supply can come and help them. So, but before we get into that, guys, here's what I want you to do. Make sure that you comment down in the video below. Make sure that you like this video. Give me that thumbs up. Subscribe to my channel. If you have not subscribed to the channel, I would appreciate that. And then I'm going to get you in contact with Lucy. She is the rep that that can help you provide a solution for our insureds that have diabetes. So with that, Lucy, hey, thank you for being on today's recording. I appreciate you.
Thank you, Luis. Good morning.
So I'm going
Thanks for having me.
Yeah, I'm so glad you're here. And I'm going to turn this thing over to you. Let's talk about what Advanced Diabetic Supply can do for our Medicare and our ACA insurance.
Perfect. So who is Advanced Diabetes Supply? We are a Medicare accredited pharmacy. We support agents on the sales side and retention of their members. And we specialize in one thing, and that's diabetes. We've been doing it for over 20 years. And we are here to support those that are having difficulty either getting their supplies at a local pharmacy or having to pay co-pays when they shouldn't be. We make sure that we bill the insurance properly so that members are getting what they're supposed to get. And if there's supposed to be no out-of-pocket costs, we make sure that that happens. So we want to make sure that they're very, very happy with the service. We are, if you will, a concierge service to the agents to help them navigate through Medicare and even the ACA, diabetes in general, because it is a very tricky item at most retail pharmacies. And so we're here to help them navigate whether they know a little something about diabetes or zero. That's all good. We're here to support. That's what I'm here to do today and every day.
So, Lucy, let me ask you a question. So on average, when somebody doesn't have coverage, or maybe they have coverage, but they're paying for stuff.
Yeah.
What are they potentially spending for the Lancets, for the test strips, for the machines when they're testing their sugar levels?
Right. So we that would be traditional testing supplies, meaning a glucometer, strips, Lancets, all the stuff that they need to poke their finger and check their blood sugar, right? What happens is those are items that are covered almost always at 100% under Medicare Part B. But what happens is that members will sometimes take their prescription to the local pharmacy. They bill things either differently or they give them whatever's on the shelf without verifying to make sure that that is a covered item. And the co-pays can range anywhere between $40 to $120 sometimes for strips alone, because they have to go with the meter that was given or sold to them. So that's something that is very common. Pharmacies aren't doing it on purpose. They just don't specialize on the one thing. We basically are the gold standard of the market.
Gotcha. Thank you. And I will tell you, I met with a senior this week, and same scenario. They were aging into Medicare. I put on a Medicare plan, and yeah, they were paying about $100 for all their diabetic supplies. I'm like, hey, not anymore. We saved you $100. Now we've got the opportunity to take that 100 and allocate it somewhere else. Maybe some expense, maybe an indemnity plan, maybe a cancer plan. There's options for that money now, and it's a big plus for our seniors. All right, go ahead, Lucy.
Yeah. So, that's just a very common scenario about the traditional supplies. And now comes the good old continuous glucose monitors. You've got members that have been poking their fingers for over 30 years. They're tired of it. They want to use that little sensor that goes on the arm, whether it's the Libre or the Dexcom. That is durable medical equipment. We also supply them with that. Depending on the plan, some of those items are covered at 100%. Some may have a copay. Copays can range anywhere between, $40 to $50, $60 a month for the sensors. Again, it depends on the plan, and we're here to help and make sure that these members get what they need and are eligible for those kind of devices. There is an eligibility thing that Medicare has for those members that want that device. They must either be insulin dependent, meaning that they are using insulin at least one time a day, not these kind of medications that are being used once a week. That's not true insulin. It has to be insulin that they inject daily. Or if they're not using insulin, then the other qualification is they must have a history of hypoglycemic events. That means that their sugar plummets, crashes below a 54. And usually people will know if that's happened. Either way, we make sure that we've got all the paperwork in order and let the patient or member know what the qualifications are prior to servicing that.
On your presentation, and would you mind going through it? I know you went to the very last slide with your information on here, but the information you had on your presentation that you did yesterday was awesome. Would you mind going through that here?
Oh, okay. Let me see if I can do that.
And while she's doing that, guys, if you want to connect with her, I'll put her information down here also. But if you'd like to connect with her, there's her cell phone. Send her a text with your first name, last name, and email, and she'll get you set up.
And I'm going to just click on this one. Is this the one you were talking about, the continuous glucose monitors?
If you would just go through it that way, agents know what you guys do, how you work with our insureds, and what you provide them.
Right. And so it's important to know that we are here to provide a service to the agents to support them, as I mentioned. And the most important thing to do would be finding those clients that are living with diabetes. In case any of your listeners don't know, out of every 3 Medicare recipients, 1 for sure is a diabetic. The CDC has shown us that through the years, there is a larger and larger propensity of diabetes. It's not going away, and people are getting younger. And so there are members out there. It's always a good idea to look through your book of business. It's when you check in with your members, ask them. The secret is you ask everybody, do you check your blood sugar at home? If it's a yes, that's someone we can call and take care of, and take care of them right away. And always make the agent look great in their members' eyes. As I said, my focus is to support the agents on their sales side to continue to grow their book of business, and also to retain those members that are very, very important. And we recently opened to ACA. I know you were mentioning ACA in the past. We were not, basically because we are strictly a Medicare pharmacy, but there's a lot of lives out there that really could use our help. And as I mentioned to you earlier this week, I'm learning as we go along, even though I've been doing this for a long time, that these ACA plans do have coverage based, I don't know if it's just based on the income or their plan, but some have high deductibles, some have copays, some may not have any copays. So we are here to support those members by doing the intake, verifying insurance, and letting them know where everything stands. And if they can afford a copay, great, we move forward. Maybe there is no copay, and great, we move forward as well. So we're here to provide that service to make sure that they are getting what they need.
And also, Lucy, I'll add this. Agents, if you're doing your job out there, if you're talking to your insureds, you're collecting the docs and the meds, you're going to find out that they're diabetics. Okay. So once you have that established, let them know, hey, we've got a solution for you. We've got a diabetes supply that can set you up with all of your diabetic supplies. So go ahead.
Yeah. And so I just pulled up this slide here with the qualifications. There's the Freestyle Libre, the Dexcom. Once again, it's important. And if you don't know whether your member is on insulin or not, that's okay. Even if they mention that they want to get this device, we will make sure that they fall under the qualifications. We always let the members know what we're doing next. We keep them engaged in the whole process. We send the paperwork to the doctor's office. We verify insurance. We call them and let them know where everything stands. And of course, before we ship, we always call them to let them know their order is ready to ship, what's going to be shipping, and we have to get their authorization. We're not a nilly-willy ship to the home and then you can't turn it off. We verify and check in with the members every 3 months to let them know it's time for a refill, and they will also give us the okay or not. So this way we're always in contact. We also service insulin pumps, Tandem, Medtronic pumps. These are usually all Part B type of items. There is one, the Omnipod, that is a Part D item, and that is because it is a disposable. These items here usually have a little bit of a copay. If there is a supplemental plan, that usually covers it. And so these are Part D items. And let's see what else. So I mean, it's a lot of information, but again, there's a lot of members or agents that really don't know anything about diabetes, and we're here to help. Sure, I want you to send us your business, absolutely, but I also want you to know that I'm a reliable resource, and you can call me and ask questions. And is it Part B? Is it Part D? Are they eligible? Can they buy it? Is there a copay? That kind of stuff. We can help navigate through all that, and also find where these items are in their explanation of coverage. I get calls from agents all the time saying, hey, they're looking for an Omnipod or a Dexcom. I don't see it anywhere on the policy. It's usually under durable medical equipment. So it's always important to know where to look for these items, because again, there are pharmacies out there that are not durable medical equipment pharmacies like we are. A member will go in with an actual prescription and they're being told this is not covered through your insurance. We want to make sure that doesn't happen. Most of these items, any Medicare recipient who is living with diabetes is eligible for either traditional testing supplies or are eligible or better said, are covered for the continuous glucose monitors. Again, depends on the glucose, depends on whether they're on insulin or not. If they're not, we can still service them with a meter and strips. There's the only two ways of checking your blood sugar right now. It's either on the arm or poking your finger. We don't have any other way right now.
Gotcha. And now, so Lucy, so agents, if you decide that you want to partner up with Lucy, it's very simple. You've got her cell number there. Hit her up, send her your information and your email, your name, first name, last name, and email, and she'll get you set up one way or another. I think you said you were Texas, and where else?
Yeah, I cover Texas and California. We do service nationwide. So for any agents that live outside of those two territories, I can always put you in contact with their point of contact in whatever state they're in. Reach out to me. We are a great team that love to work with our agents and our seniors. Seniors are not seniors, right? Anybody who's a Medicare recipient and now ACA recipient. So we're able to work with them to help them out with their supplies that are they're in need of.
Now, Lucy, I sent you a couple, or one last week that I can remember. As far as how an agent gets one of their insureds set up with you, do you have something you can show us that process? Because I did it online. It was very easy to do.
It was very easy. As you see on my contact info, there is a QR code. For those of you that reach out to me, I can send that QR code or the link. It is a secure link. Remember, we follow Medicare guidelines. We are accredited through Medicare and a few other Medicare type of associations. So it is secure. You would fill out a simple form, name, date of birth, a phone number. If you have a little more information, great. We always want to know who referred them, simply because, we're working together to take care of your member. We want to make sure that the member knows that it was you who requested we call them. We call on your behalf. And also, as I mentioned, sometimes members are starting to ask questions about their plan. Maybe they want to make changes. I want to be able to refer them back to you because you're the one who referred them. It's very important for agents to know. Again, we follow Medicare guidelines. We are not here to market to members. We are not here to switch agents members on agents. We are here to provide a service and work together with you to make sure that your member is taken care of. So feel free, and that information is secure. That form will come to me directly and our intake team. We are also bilingual, lots of Spanish and English. I can help support the agents with some flyers if they have events at no cost. And we also have a translation service. So for anybody out there who is in a community or has members that speak different languages, we do have a translation service. So everybody should be able to get serviced in whatever language they speak.
I'm looking at the form right now, Lucy, and it's pretty easy. Yeah, it's asking me for the client name, the client date of birth, their phone number, their primary language, and their address.
And it also asks you if it's Medicare or ACA. We did change that recently when we opened up the door. Yeah. And then we also request, if they have Medicare, put down their Medicare number. A lot of our seniors have a difficult time either finding that number or are afraid to give it out. We do have to verify for those that are on a Medicare plan because we verify what the primary insurance is on the Medicare stamp. So it is important that we do get that. And of course, if you happen to have their ID number with whatever plan they're on, that would be great. Otherwise, we're going to connect with your member anyway, call them on your behalf and get all that information and then submit the paperwork to the doctor's office, verify insurance, keep the member engaged throughout the process. And of course, as soon as everything is received and ready to go, we will reach out to them and let them know we're ready to ship.
And the supplies that get sent to our insureds, is that a monthly, quarterly? How do and
90 days, every 90 days.
Okay.
And those that are on traditional will get a recorded call after the initial, we let them know that after their initial shipment, in about 90 days before you run out, we're going to call you to let you know it's time for a refill. I think it's press 1 for yes, 2 for no. It's a recorded call. We make it really easy. That way they know it's coming and we have their authorization.
Got it. And so so you guys are sending them the monitor, Lancets, test strips, all that's going to them.
All that's going to them, correct. And if they're injecting insulin, we supply the pen needles or syringes, alcohol wipes, those ancillaries that some members need. If they're not on insulin, well, then they're just using the meter and strips and all of that, and we'll refill the strips every 3 months after they get their initial kit, which includes everything.
Great. And now, guys, I'm putting my sales hat on. Okay, so think about this, agents. If you're like, nah, you know what? They go to the pharmacy. That's fine. I'm not going to mess with this thing. Think about this. Who sits at these pharmacies during AEP and OEP? Other agents. Okay. And guess what those other agents are trying to do? They're trying to flip them or acquire business. So do yourself a favor. Set up your client with advanced diabetic supplies or advanced diabetes supplies. Get them to not go to the pharmacy just one less time so that they have less of a chance to interact with another agent so that you can maintain your book of business. This is, not only are we doing this to help our insureds, but, again, selfishly, we're doing it for ourselves so that we don't give that agent that's sitting at the pharmacy the opportunity to potentially flip our clients to a different plan. So think about it that way. You may say, I don't want to mess with it. They're okay. It is what it is. I'm just going to let it be. But now start thinking about the fact that if you can keep them out of the pharmacy and out of the ability of another agent to potentially move them to another plan, it's just another reason why you want to hook up with Lucy. So,
right. And if I can piggyback on that, on our end, we want to make sure that those members, especially the elderly members, are not having to go to the pharmacy to pick things up. We want to make it really easy. We don't want them getting sick. Some of them are already, have a lot of health issues. I think that when COVID hit, we want to make sure people were safe at home and receiving their supplies at home and not having to leave the house. And on top of that, we want to make sure that there's not going to be those mistakes that the pharmacy might make, not on purpose, but it happens, and they're paying copays, and now they're upset, and we want to avoid rapid disenrollment, right? We don't want an unhappy member. You
Right.
said that this was covered. How come I'm paying? Well, we want to make sure that doesn't happen from the start.
Awesome, awesome. Well, guys,
Yeah.
if you want to hook up with Lucy, there's her information, her name, her cell number, her email, and what she needs from you to get you set up is first, last name, and your email. So
Yeah,
take
that way I
advantage
can
of-
connect with you. Uh-huh.
Yep, and if they're not in California or Austin, then you'll hook them up with a rep in their area.
Correct.
Awesome. Okay, Lucy, thank you. I think we nailed it. Pretty easy.
Luis, that's always a pleasure. Thank you. Thanks for having me on. Yes, let me know if there's anything else I can assist with.
So guys,
Happy to help.
don't forget down below in the more section, what I will do is I'll put her information down there so you can connect with her. And I've got goodies down there for you guys. Don't forget, I've got my CRM, I've got my ACA 101 course, I have my smart books for Medicare and ACA, and I also got information on my Facebook ad course that we promote for you guys to run Facebook ads if you want to. So with that, again, thank you so much. Don't forget to comment, like, and subscribe. This is Luis Moreno with Think Medicare, Think ACA.